And for more on the outbreak, I'm joined by Democratic Congressman Ruiz from California, who's also an emergency room physician. Thanks so much for being with us, Congressman. So are you seeing an uptick in your area of California in coronavirus cases?
Yes, I represent California's 36th district. It's the Palm Springs, Coachella Valley area in Southern California, bordering Arizona. We've had 3 deaths out of the total 13 in the entire state. And the reason why my area is more vulnerable is because we have the demographics of 30% are older than 60. We have higher rates of diabetes, of cardiopulmonary disease, and HIV infection, as well as we have less capacity in our hospitals like big urban centers do. So I've been on the phone with the county as well as the state and the national authorities to really pay attention to the Coachella Valley as a hotspot because we can lose a lot of lives.
Are your hospitals beginning to be overwhelmed?
They're not at the overwhelmed phase right now. However, there is great concerns given the modeling predictions of the surge that's coming that they don't have enough, will not have enough masks or ventilators, and also at this point it's not necessarily the overwhelming of the system that can lead to mortality. It's also the high-risk demographics of the population who are older and have illnesses that can put them at risk of dying.
So what are you expecting to see when that surge comes to your district? What are you bracing for?
Well, I'm working right now with the state and the county to call for a very specific strike team so that we can open up a more efficient form of testing, of clearance from hospitals, as well as logistic chain supply chains, so that we can act in real time and get the resources that we need specifically here in the Coachella Valley, because it is a hot spot in California that, because it's not in a big urban center like LA, San Francisco, oftentimes gets dismissed. So we're not going to let that happen, and we're moving the ball forward. It's up to all of us to take the responsibilities in every community across America to make sure that we practice our social distancing and avoid spreading the virus. You see, the depth of the economic recession, the length that we're going to be in a recession, is directly dependent on the peak of transmission as well as the length of transmission of the coronavirus. So we have to do our parts to get a hold of the coronavirus in order to help the economy.
I saw that you held a virtual town hall this morning. What were people saying to you about this $1 trillion stimulus plan that's in the works? What do they need now?
Well, a lot of workers and parents need immediate financial support because they're not working and they can't go to work because their children are home, and so they have to be home to take care of their kids. The good news is that the president passed the bill that the House of Representatives passed several days ago, the Family First Coronavirus Recovery Act. That expands unemployment insurance for states. That also gives businesses and workers the Family Medical Leave Act provisions for them to get tested, take care of people who are quarantined or stay home because their kids are home. It also expands paid sick leave for businesses that don't provide that for the workers for those criteria as well. So now it also has tax credits for the small businesses who comply with those new provisions, and for those who are self-employed. We still need a larger economic stimulus package that will also add to the worker and the family protections that this first bill did.
Congressman Ruiz, thank you so much for joining us.
Thank you.